Happy evening, viewers. Welcome to yet another episode of GarbhaSandesha. This is our 28th episode. And today's topic of discussion will be the most important IVF FAQs, frequently asked questions. And to talk about this, we have Dr. Chinmayie and Dr. Jahnavi with us. Let me remind all the viewers that in today's episode, you can have your questions answered in English, Kannada, and Telugu. Please go ahead and keep those questions coming in. Now, let me introduce you to Dr. Chinmayie. Dr. Chinmayie is a fertility expert with 8 years of experience in gynecology and infertility. She holds a fellowship in reproductive medicine from RGHS. She has also been active in the world of academia. In addition to clinical experience, Dr. Chinmayie has a compassionate and caring nature. She practices at Garbhagudi's Southern Circle branch. Next, we have Dr. Jahnavi, who is a diligent and dedicated fertility expert practicing at Garbhagudi IVF Center at our Electronic City Center. She has sound knowledge on gynecology, obstetrics, and infertility. Dr. Jahnavi holds a fellowship in reproductive medicine, and she has authored and co-authored several papers published in international journals. She is known for her approachable nature and immense dedication to her profession. Welcome you, doctors, both to the 28th episode. I also would like to tell our viewers that this being a IVF day month, we are, Garbhagudi is offering 20% discount on all the blood tests in all our branches and 20% discount on IVF injections. I would request all our viewers to take this offer at all our branches in Bangalore. Now, I would like to ask Dr. Chinmayie Madam on the topic. What's your take on today's IVF frequently asked questions?
I would like to start by saying IVF meaning in vitro fertilization. One of the techniques that we follow in infertility for the couple who present to us, but that doesn't mean that everybody requires. But when we choose the patient who really benefit by performing IVF, they will give us good results. And also they come with a lot of doubts, like what would be the procedure, how it goes about. So in today's session, we'll be clearing all those doubts. And I am very sure that most of them will get completely clarified with all their doubts and will know that it is not something to be scared of, not a major procedure that you have to worry about. It is safe and still very effective procedure.
Thank you, madam. Now, I'll start my questions with you itself, Dr. Chinmayie Madam. What is IVF and who's the ideal candidate for IVF?
So IVF meaning in vitro fertilization, where the oocytes, which is produced from the ovary, are taken outside the body. And then similarly, we collect the sperm from the husband and then we fertilize each egg outside. That in the word in vitro meaning something that happens outside the body. So we are fertilizing the ovum and the sperm outside the body, hence it derives its name as in vitro fertilization. So what we do when we are collecting it, we will grow it in a laboratory, which will give what all the required nutrition and environment that is necessary for an embryo to grow. And then that embryo will be transferred into the uterus for further growth. So this procedure is IVF. So who really requires these procedures are those who have had any surgeries on their tubes or the tubes are being blocked. We have different factors. It could be in case of females or could be male factor. So when a woman presents with tubal blockage, there are tubes on both sides of the uterus, and only if the tubes are functioning normally, they can conceive naturally or through simple techniques like IUI. Whenever it is non-functional, it is blocked or it is being removed, they will definitely require IVF. Or those who have had who's more than 35 years years of age, and the egg reserve, that means the number of eggs in the ovaries are reducing and become critically low, they require IVF. And those who have had multiple IUI failures, or they have had multiple miscarriages, so those patients will be benefited. Similarly, in case of males, when they present with azoospermia, severe oligoastenospermia, or they have got teratozoospermia, so all these kind of abnormalities, when we perform IVF or an ICSI procedure, they will be more benefited, because the count and the motility of the sperms will be lesser. So when we take each sperm and inject into one egg separately during an ICSI procedure, the chance of fertilization, getting good quality embryos, chance of that conception is definitely higher. So it again depends on both male and female factors. Some patients, some couple might have both female and male factor, and these were the few examples which I gave who will be benefited through IVF procedure.
Thank you, madam. Dr. Jahnavi, what are the reasons for infertility?
Sir, first of all, thank you for having me here. I think it is a very good, it is an important topic, because most of the people will have a lot of queries regarding IVF, and what they'll do is they'll go on search engines and search for something, and they'll get what all information is blown out of proportion, and they might get wrong information. So definitely information from the expert will definitely help the couple. And to answer your question, like Dr. Chinmayie has just said, there are different reasons for infertility. It can be a male factor or it can be a female factor. It can be the problem with the husband or problem with the wife. More often than not, it can be a problem with both of them, with small issues with both of them. Reason for male problems can be problems with sperm quality, sperm number, and problems with the DNA of the sperm. Those are the three major issues which we see routinely. And problems with females are mainly, again, categorized. They are categorized. It can be a problem with the tube. It can be a problem with the egg release. It can be the problem with the egg count, and it can be a problem with the egg quality also. And when both these are present, even in small amount of sperm quality issues there, and small amount of egg quality and number issues there, then also it can lead to infertility.
Thank you, madam. And Dr. Chinmayie, what are the difference between IVF and ICSI?
As I told you, they both mean more or less the same. The entire procedure, like collecting the oocytes outside, all those remains the same. The only difference there is how we are going to fertilize the oocytes is the difference between the two procedures. So here, once the oocytes are collected in IVF, they will be placed in one dish, and the prepared semen sample where the sperms are separated, good quality sperms are selected, and those good quality sperms are just left inside the dish. And then that dish will be kept at 37 degrees. That is our body temperature. So we maintain at that temperature inside the incubator, which gives all the environment that is required for 18 hours, and then allow the fertilization to happen on its own. Whereas in case of ICSI, that is intracytoplasmic sperm injection, what we do is where we select each good quality sperm and then inject into the oocyte directly, and then we incubate it. In case of IVF, we place together in one dish and leave it. Whereas here we inject one sperm into the egg separately and then place it inside the incubator. So those who really require ICSI procedure are those mainly presenting with male factor infertility. Like as I told, when the sperm count is very less or the quality of the sperm is very less, where we need to select those which are high quality sperms through high magnification microscope and then transfer and then injected. Or when we take a testicular sample, like those who have had ASO where no sperms are seen in their semen sample, and we take samples sperms directly from the testis, such sperms we have to do an ICSI procedure. So that and especially though sometimes the patient would have undergone an IVF before, and they've seen that where one of the patient presented, their IVF was done, and they had got about 15 eggs, out of which only 8 eggs fertilized. Sometimes when there is minimal amount of male factor where the husband semen also has some problem and an IVF has been attempted, all the eggs might not fertilize. So what we did in the next cycle is we performed an ICSI procedure for them because his count was about 1.2 million, which was very less. And the forward moving capacity of the sperms was also around 5% only. So when we performed ICSI, where we could select each sperm separately and then injected one sperm into each egg, in the next time she got about 14 eggs, out of which 13 fertilized. So like this, we can improve the fertilization by selecting the better sperm, especially in case of male factor infertility. So the chance, how we fertilize the egg is the only difference between the two procedures.
Thank you, madam. ಒಂದು ಕನ್ನಡ ಕ್ವಶನ್ ಇದೆ ನಿಮ್ಗೆ. ಶುಭಾ ಬಿರಾದರ್ ಅವರು ಬರೀತಾರೆ, ಮೇಡಮ್ ನಂದು ಲೆಪ್ರೋಸ್ಕೋಪಿ ಅಂಡ್ ಹಿಸ್ಟ್ರೋಸ್ಕೋಪಿ ಆಗಿದೆ, AMH ಲೆವೆಲ್ 1.71, ಲೆಫ್ಟ್ ಟ್ಯೂಬ್ ಅಲ್ಲಿ ಆರ್ಡರ್ ಟು ಓವರಿ ಸ್ಪ್ಲಿಟ್ ಇಮ್ಸಿ ಅಡಿಷನ್ ಇದೆ.
ಸಾರಿ, ಐ ಡಿಡ್ಂಟ್ ಗೆಟ್. ಲೆಫ್ಟ್ ಟ್ಯೂಬ್ ಅಲ್ಲಿ ಆರ್ಡರ್ ಟು ಓವರಿ ಸ್ಪ್ಲಿಟ್ ಹಿಮ್ಸಿ ಅಡಿಷನ್ ಇದೆ. ಒನ್ ಓವರಿಯಲ್ಲಿ ಸ್ಮಾಲ್ ಎಂಡೋಮೆಟ್ರಿಕ್ ಸಿಸ್ಟ್ ರಪ್ಚರ್ ಮಾಡಿದ್ದಾರೆ. ನನ್ನ ಏಜ್ 26, ಅಕ್ಯುರೇಟ್ ಟೈಪ್ ಯೂಟ್ರಸ್ ಇದೆ. ಸೊ ಅದಕ್ಕೆ ನನಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಿದ್ದ ಡಾಕ್ಟರು ಬೆಟರ್ ಗೋ ಫಾರ್ IVF ಅಂತ ಹೇಳಿದ್ದಾರೆ. ಸೊ ಸೊಲ್ಯೂಷನ್ ಹೇಳಿ. IUI ಬೇಡ ಅಂತ ಹೇಳಿದ್ದಾರೆ. ಯಾಕೆ IUI ಮಾಡದಿದ್ರೆ ಯೂಸ್ ಇಲ್ವಾ? ಇನ್ನು 7-8 months ವೇಟ್ ಮಾಡಬಹುದಾ? ಈಗ ನಿಮ್ಮಲ್ಲಿ ಇರೋದು ಎರಡು ರೀತಿಯ ತರ ಇದೆ. ಒಂದು ನಿಮ್ಗೆ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಇರೋದು. ಸೊ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಅಲ್ಲಿ 4 ತರ ಇರುತ್ತೆ: ಮಿನಿಮಲ್, ಮೈಲ್ಡ್, ಮಾಡರೇಟ್, ಸಿವಿಯರ್ ಅಂತ. ಸೊ ನಾವು ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿ ಮಾಡಿದಾಗ ನಿಮಗೆ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಯಾವ ಸ್ಟೇಜ್ ನಲ್ಲಿ ಇದೆ ಅಂತ ಅಸೆಸ್ ಮಾಡ್ತೀವಿ. ಅದ್ರ ಜೊತೆಗೆ ನಿಮ್ ಟ್ಯೂಬ್ಸ್ ನಾರ್ಮಲ್ ಆಗಿ ಫಂಕ್ಷನಿಂಗ್ ಆಗ್ತಿದ್ಯಾ, ಆ ಟ್ಯೂಬ್ ಫಂಕ್ಷನಿಂಗ್ ಅಂದ್ರೆ ಜಸ್ಟ್ ಓಪನ್ ಒಂದೇ ಇರೋದು ಇಂಪಾರ್ಟೆಂಟ್ ಅಲ್ಲ, ಅದು ಒಳಗಡೆ ನಾವು ಡೈ ಇಂಜೆಕ್ಟ್ ಮಾಡಿದಾಗ ಈ ತರ ದಪ್ಪ ದಪ್ಪ ಆಗೋದು, ಕಂಪ್ಲೀಟ್ ಆಗಿ ರೆಡ್ ಅಥವಾ ಕಂಜೆಸ್ಟೆಡ್ ಅಂತ ಕರಿತೀವಿ, ಆ ತರ ಇರೋದು, ಒಂದಕ್ಕೊಂದು ಕಂಟ್ಕೊಂಡಿರೋದು, ಅಂತ ಟ್ಯೂಬ್ ನಿಂದ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗೋ ಚಾನ್ಸಸ್ IUI ಮಾಡಿದ್ರು ಚಾನ್ಸಸ್ ವಿಲ್ ಬಿ ಲೆಸ್ ದೆನ್ 10%. ತುಂಬಾ ಕಮ್ಮಿ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಒಂದು. ಎರಡನೇದು, ಕೆಲವು ಸತಿ ಟ್ಯೂಬ್ ನಲ್ಲೇ ಪ್ರೆಗ್ನೆನ್ಸಿ ಉಳ್ಕೊಂಡು ಆ ಟ್ಯೂಬ್ ನೇ ರಿಮೂವ್ ಮಾಡುವಂತ ಪರಿಸ್ಥಿತಿ ಬರಬಹುದು. ಸೊ ಒಂದು ಚಾನ್ಸ್ ಕಮ್ಮಿ ಇರೋದು. ಮತ್ತೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಹೆಲ್ದಿಯಾಗಿ ಆಗೋದು ತೊಂದರೆ ಇದ್ದಾಗ IVF ಅವಶ್ಯಕತೆ ಬರುತ್ತೆ. ಮತ್ತೆ ನಿಮ್ ಸಿಸ್ಟ್ ಸೈಜ್ ದೊಡ್ಡದಿದ್ದು ಅದನ್ನ ರಿಮೂವ್ ಮಾಡಿದ್ಮೇಲೆ ಯಾವಾಗ್ಲೂ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಇಸ್ ಎ ಡಿಸೀಸ್ ವಿಚ್ ಇಸ್ ನೋನ್ ಟು ರಿಕರ್. ಅದ್ ಯಾವಾಗ್ಲೂ ಮತ್ತೆ ಬರೋ ಸಾಧ್ಯತೆನೆ ಇರುತ್ತೆ. ಅದು ಮತ್ತೆ ಬರೋದ್ರೊಳಗೆ, ಈಗ ಸರ್ಜರಿ ಆಗಿದೆ ಅಂದ್ರೆ ವಿದಿನ್ 6 months ನೀವು ಟ್ರೀಟ್ಮೆಂಟ್ ನ ಪ್ಲಾನ್ ಮಾಡಬೇಕು. ಈಗ IUI ಅಲ್ಲಿ ನೀವು 2 months 3 months ವಿತ್ ನೋ ಸಕ್ಸಸ್ ರೇಟ್ ಟ್ರೈ ಮಾಡಿ ಮುಂದಕ್ಕೆ ಹಾಕಿದಾಗ ಅದು ನಿಮ್ಗೆ ಸಕ್ಸಸ್ ಕೊಡ್ಲಿಲ್ಲ ಅಂದ್ರೆ ಅಷ್ಟೊತ್ತಿಗೆ ಇವನ್ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ವಾಪಸ್ ಬರೋಕ್ ಶುರುವಾಗುತ್ತೆ. ಅವಾಗ ಮತ್ತೆ ನೀವು IVF ಹೋಗ್ಬೇಕು ಅಂದ್ರೂ ಸಕ್ಸಸ್ ರೇಟ್ ಡ್ರಾಪ್ ಆಗುತ್ತೆ. ಸೊ ಮಾಡರೇಟ್ ಟು ಸಿವಿಯರ್ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಅಥವಾ ಮೈಲ್ಡ್ ಟು ಮಿನಿಮಲ್ ಇದ್ರು, ಇವನ್ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಸಿವಿಯರಿಟಿ ಕಮ್ಮಿ ಇದ್ದು ಟ್ಯೂಬ್ಸ್ ಹೆಲ್ದಿ ಆಗಿಲ್ಲ ಅಥವಾ ಟ್ಯೂಬ್ ಫಂಕ್ಷನಿಂಗ್ ಸರಿ ಇಲ್ಲ ಅಂತ ಇದ್ದಾಗ ಅಂತವ್ರು IVF ಇಂದ ಎಷ್ಟು ಬೇಗ ಮಾಡಿಸ್ಕೊಳ್ತಾರೋ ಅಷ್ಟು ಒಳ್ಳೆ ಸಕ್ಸಸ್ ರೇಟ್ ನ ಪಡ್ಕೊಳ್ಬಹುದು. ಸೊ ಅಂಡ್ ಆರ್ಕ್ಯುವೇಟ್ ಯೂಟ್ರಸ್ ವರಿ ಮಾಡೋದು ಬೇಡ. ಇಟ್ ಇಸ್ ನಾಟ್ ಮೇಜರ್ ಅಬ್ನಾರ್ಮ್ಯಾಲಿಟಿ ತರ ಇಲ್ಲ. ಇಟ್ ಇಸ್ ಕನ್ಸಿಡರ್ಡ್ ನಾರ್ಮಲ್ ಓನ್ಲಿ. ಅದರಿಂದ ನಿಮ್ ಪ್ರೆಗ್ನೆನ್ಸಿಗೆ ತೊಂದರೆ ಆಗುತ್ತೆ ಅಂತ ಹೇಳಲ್ಲ. ಸೊ ನಿಮಗೆ ಪ್ರಾಬ್ಲಮ್ ಆಗೋದು ಒಂದು ಬಿಕಾಸ್ ಆಫ್ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್. ಅದನ್ನ ನಾವು ನೋಡ್ಕೊಳ್ಳೋದ್ರೆ ಮಿನಿಮಲ್ ಫಾರ್ಮ್ ಇದ್ರೆ ಏನಂತ ಮೇಜರ್ ಇಶ್ಯೂಸ್ ಬರೋದಿಲ್ಲ. ಸೊ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಇದೆ ಒಂದಕ್ಕೊಂದು ಕಂಡುಕೊಂಡು ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗೋದಕ್ಕೆ ಖಂಡಿತವಾಗ್ಲೂ ತೊಂದರೆ ಆಗುತ್ತೆ ಟ್ಯೂಬ್ ಫಂಕ್ಷನಿಂಗ್ ಅಫೆಕ್ಟ್ ಆದಾಗ. ಸೊ IVF ಹೋಗೋದು ಉತ್ತಮನೇ ಇರುತ್ತೆ, ನಿಮ್ಗೆ ಬೇಗ ರಿಸಲ್ಟ್ಸ್ ಕಾಣಬಹುದು ನೀವು.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಶುಭಾ ಬಿರಾದರ್ ಅವರೇ, ನಿಮ್ಗೆ ಉತ್ತರ ಸಿಕ್ತು ಅಂದ್ಕೋತೇನೆ. ಡಾಕ್ಟರ್ ಜಾನ್ವಿ ಮೇಡಮ್, next question is from the viewer called Monica C. Reddy. I think you can answer in Telugu. She is asking, Madam, what is the IVF cost?
Namaskaram andi Monica. IVF cost మీరు అడిగారు, బట్ IVF లోనే చాలా టైప్స్ అంటే చాలా ప్రొసీజర్స్ ఉన్నాయన్నమాట మనం చేయగలిగినవి. సో IVF కాస్ట్ నేను రఫ్ గా చెప్తాను. ప్రొసీజర్ వరకు అయితే 1.5 lakh అవ్వచ్చు. బట్ ద ప్రాబ్లమ్ ఇస్ మనం ఏ టైప్ ఆఫ్ IVF కి వెళ్ళాలి, IVF తర్వాత చేయగలిగే ప్రొసీజర్స్ చాలా ఉన్నాయి, స్పర్మ్ క్వాలిటీ ఎలా ఉంది, ఎగ్ కౌంట్ ఎలా ఉంది, ఇదంతా చూస్తేనే మనం కరెక్ట్ గా IVF కాస్ట్ అసెస్ చేయడానికి అవుతుంది అనమాట. అసలు బేసికల్లీ IVF అనేది కొంచెం లిటిల్ ఆన్ ద ఎక్స్పెన్సివ్ సైడే వస్తుంది. ఎందుకంటే వాట్ ఎవర్ మెడిసిన్స్ వీఆర్ యూజింగ్, అంటే మనం ఏదైతే మెడిసిన్స్ యూజ్ చేస్తామో ఎగ్ సర్వైవల్ కి, స్పర్మ్ సర్వైవల్ కి ఏదైతే మెడిసిన్స్ యూజ్ చేస్తామో 3 days మనం ఎంబ్రియోని గ్రో చేయాలి, బేబీ లోపల గ్రో చేయాలి. సో ఇదంతా కొంచెం స్టిరైల్ గా ఏమి ఇన్ఫెక్షన్ రాకుండా ఇవన్నీ మెయింటైన్ చేయాలి. కాబట్టి ఆ ప్రొసీజర్ కొంచెం ఉంటుంది, అది అందరికీ కామన్ ఉంటుంది. తర్వాత మీ పర్టిక్యులర్ కపుల్ కి మీ ఏజ్ ఎంత, మీ వెయిట్ ఎంత, తర్వాత మీ ఎగ్ కౌంట్ ఎంత, మీ హస్బెండ్ స్పర్మ్స్ ఎలా ఉన్నాయి, ఇవన్నీ చూసి మొత్తంగా మనకి ఐవీఎఫ్ కాస్ట్ చెప్పడం జరుగుతుంది అనమాట. రఫ్ గా నేను 1.5 చెప్పాను కానీ, బట్ అగైన్ మెడిసిన్స్ ఇదంతా ఎక్స్ట్రా మనకి ఏంటి ఎక్స్ట్రా అవుతుందా. కొంతమంది థిన్ పేషెంట్స్ ఉంటారు, యంగ్ పేషెంట్స్ ఉంటారు, లెస్ దెన్ 35 years, ఎక్కువ ఎగ్స్ ఉంటాయి. సో వాళ్ళకి ఎక్కువ ఇంజెక్షన్స్ డోస్ అవ్వదు, వాళ్ళకి తక్కువ ఇంజెక్షన్స్ డోస్ లోనే సరిపోతుంది. కొంతమంది కొంచెం ఎగ్ కౌంట్ తక్కువగా ఉంటుంది, ఎగ్ కౌంట్ 1, 3, 4 అట్లానే ఉంటుంది. సో వాళ్ళకి ఎక్కువ ఇంజెక్షన్స్ పడతాయి అనమాట. అలా డిఫరెన్స్ అనేది వస్తుంది. అండ్ స్పర్మ్ కౌంట్ కూడా, స్పర్మ్స్ నెంబర్ కౌంట్ బాగుంది, స్పర్మ్స్ మార్ఫాలజీ బాగుంది అంటే, షేప్ ఆఫ్ ద స్పర్మ్స్, స్పర్మ్ క్వాలిటీ ఇదంతా బాగుంది అంటే మనం డైరెక్ట్ గా నార్మల్ స్పర్మ్ యూజ్ చేయొచ్చు. బట్ స్పర్మ్ ప్రాబ్లం ఉంది, మనకు అసలు స్పర్మ్స్ ఏ రావట్లేదు అంటే కూడా దానిలో నుంచి అంటే టెస్టెస్ బీజాల్లోంచి స్పర్మ్స్ ఇంజెక్ట్ చేసి రిమూవ్ చేయడం జరుగుతుంది. సో దీని వల్ల మనకి కాస్ట్ యాడ్ అవుతుంది. అదర్వైజ్ యూజువలీ నార్మల్ స్పర్మ్స్ సరిపోయే పని అయితే అంత కాస్ట్ అవ్వదు. సో ఈ ఫ్యాక్టర్స్ అన్ని బేస్ చేసుకుని మనం కాస్ట్ డిసైడ్ చేయడం జరుగుతుంది.
థ్యాంక్ యూ మేడం. I think Mrs. Monica got her answer. The next question is to you only, Dr. Jahnavi. What is IUI and how are the success rates with it?
So IUI is where we see the wife on the day two of her cycle. We give her some medicines or we monitor her in a natural cycle to see if egg is growing. When the egg is growing, we give an injection for the egg release and we time the injection so that during the time of egg release, we can process the sperm sample of the husband and directly inject into her uterus. This definitely helps in couples who have been trying natural and have not succeeded and have little sperm issues. The sperm count is less or motility is less or sperm's shape is less, because while processing the sperm sample, we can select good sperms and good moving sperms. And by injection into the uterus, we can reduce the distance to be moved by the sperms also, distance required for the sperms to move. So all this will help in increasing the success rates. But the average success rates, if we take all the IUIs together, it will be around 30%, I can tell. It is much less than IVF, but IUI is much easier technique than an IVF.
Thank you, madam. And Dr. Chinmayie, what are the risks associated with IVF?
With the new advent of all the newer medications and techniques, as such, nothing major risk that a couple should be worried of. But yes, especially in those who have had multiple eggs, especially when we see a PCOD woman undergoing IVF where they have many eggs being retrieved. So in them, they will have a slight risk of developing an issue called OHSS, which is called as ovarian hyperstimulation syndrome. That can be taken care if we choose the right injection, the right protocol, and certain steps from the patient side by consuming a lot of water, taking more high protein diet. So all these things we can, if we take precautionary measures, definitely we can prevent it from happening. And it is not very major, which can be managed in OPD only. Other than that, just that patient has to take daily injections and they might be a little worried of whether it is painful. But no, most of the injections are not painful because it is given subcutaneously. So it is not a painful injection. Then next, whether to worry about it will cause any abnormalities if you take this injection for a long time. So nothing like that, because they are the natural hormones which is being produced in the body every cycle. But what happens is the hormone that is produced in the body can produce only 1 or 2 eggs. So we give the same hormone at a higher dose for a shorter period of time. So hence it will not cause any side effects. So, and we do see many patients coming and asking if you take out so many the eggs this month, if you take out all the 15 eggs, will I ovulate next month? Definitely yes, because there is something called as egg recruitment. Only those eggs which have come up, we can remove that. We cannot touch the reservoir. So therefore, if we whatever is available for that particular cycle only will be retrieved in that IVF cycle. Next cycle, she will ovulate naturally. She can have her natural cycle. Everything will be like her usual cycles only. So nothing is going to change through the procedure. Next, that many patients will be worried of whether the child will be normal like any normal pregnancy, or will they be prone for any abnormal babies like that. Definitely not to worry, because there is a lot of studies which has been published, proved so far, saying that whatever normal pregnancy risk has, same risk exists with IVF also. Not to worry about any abnormal babies being born with IVF per se. So as such, IVF is not a very dreadful procedure. It is a simple, safe technique which will not cause any harmful effects even on long-term issues.
Thank you, madam. There's a question to you. This is from Uma Maheshwari Singhani. Hello, ma'am. We had gone through IVF and embryo transfer processes day 3 at your facility, and both cases we didn't get result. We are very disappointed. What are the next step you would like us to go? We do trust you, but what is the best way to go through?
Sir, I would like to know what is her age now? What is the age and why did they go for IVF?
She has not mentioned the age.
She has not mentioned.
Mrs. Uma Maheshwari, if you could mention your age right now.
Okay, but then there will be various reasons why an IVF can fail. So before going forward, if she does not have any frozen embryos left, then we need to evaluate why it failed. What could be the possible reasons? There can be any number of causes. So we need to say male factor separately and female factor separately. One is
I think Dr. Chinmaye's video is stuck. Jairam sir?
Madam.
I think Dr. Chinmaye's video is stuck. With your permission, I will go ahead.
Yeah, please do, madam.
Yeah, Mrs. Uma Maheshwari, we are sorry, we sympathize with you. I think you have underwent 2 embryo transfers from what I understood from your question. See, that like Dr. Chinmayie was telling, there are n number of reasons for an IVF to fail. See, there can be an embryo quality issue, or there can be receptivity issue. Receptivity in the sense the way we take the baby. Embryo quality is the way the baby is going to attach to our womb. Both these can have little issues in them. Don't worry about it. IVF has been with us since 1980s. We are way advanced after IVF also. We have n number of techniques which are available. We don't do all the advanced techniques to everybody because simply it's not required. If you have failed IVF, please come back to us. We will evaluate where the problem is exactly, whether it is the embryo problem or it is the receptivity problem. Once we have evaluated, then our path becomes easy. There are n number of tests we can do for the embryos to see which is the receptive one, which is the implantable embryo, which gives us the best result, and then we can do an embryo transfer. Again, there are n number of tests we can do on endometrium, that is our own womb, to see the best possible day where the baby is going to implant. So all these tests can be done. They are called ERA and PGT. We just don't do them for everybody because for every couple it is not required, and it boosts up the cost of the couple also. They're not pocket friendly. But we need a thorough evaluation if an IVF has failed. Okay, then further after evaluation, after finding out where the problem is, we'll be able to take up from there.
Thank you, madam. Uma Maheshwari Singhani, madam. I think you were lucky to have feedback from 2 doctors. Well, next question is to you itself, Dr. Jahnavi.
Yes.
Is there anything that could negatively impact IVF success? I think you've already answered that in this.
Yes.
Then I will take it forward.
Yes.
What are the potential side effects of undergoing IVF?
I think Dr. Chinmayie has already mentioned few. When a woman is thin and she has a lot of eggs, there is something called an ovarian hyperstimulation syndrome. Again, that is a very rare complication and very, extreme complication we are looking at it. And with modern medicines, it has been almost totally eliminated. Very rarely we do see OHSS patients. The other common side effects are usually bloating sensation, mood swings, constipation. These are the common side effects which we see while during an IVF, while stimulating a patient. And again, the IVF stimulation goes on for about 2 weeks roughly. When you take that timeline, these side effects can come towards the last 2-3 days of the IVF stimulation. After that, they will be gone. And once the patient's pickup is done, pickup means that is we remove the eggs out of the patient. Usually, all these symptoms will settle down. And once the patient has her next period, all the symptoms will settle down and she'll be as good as any other patient.
Thank you, madam. Next question is, what is PISA and TISA?
Okay, what is PISA and TISA is, for some men, there will be an issue called azoospermia. What is azoospermia? It means they will have sperm production inside, but some of the sperms cannot come outside, okay, because of the block in the duct that is called obstructive azoospermia. In such men, or when the quality of the sperms is also very poor, quality of the sperms which are coming outside is very poor, we can make advantage of techniques called TISA or PISA, where the sperms can be retrieved from the testis itself, from the source where they are produced itself. There we can retrieve the sperms. We can get the sperms out with a simple procedure that is called testicular sperm extraction. There we can extract the sperms and use those sperms to inject directly into the egg. That is called an ICSI procedure. With that, usually the results are pretty good, because when we are looking at azoospermia, the major cause of the patient, why the couple has not conceived, is because of the sperms. Once that is taken care of, usually when in such cases the women factor will be very less, so they will have very good results.
Thank you, madam. What is empty follicles?
Empty follicles. Usually in a scan, when we do an IVF, we do 4 or 5 scans in around 2-3 weeks, in around 2 weeks. In those 4 or 5 scans, what we assess is called follicles. An ovary, ovary will have many number of follicles. Usually each follicle will have an egg inside it. But since the egg is very tiny, it is not usually possible for us to see in scan. Egg directly visualization in the scan is not possible. So what we do is we see the follicle, we measure the follicle size, and we assume that each follicle has an egg in it. But sometimes, again, the chances we are talking about is around 100%, sorry, 1%, in that is 1 in 100 cases. So in such cases, there is a possibility that we see follicles in the scan. But when we try to retrieve the egg, when we try to get the egg out, you will see that the follicle is empty. That is again more common in cases like patients who have endometriosis, that is a cyst, a blood clot in the ovary, or patients who have very less number of eggs. In such patients, again, some patients are genetically also prone to empty follicular syndrome, where we try to aspirate the follicle, we try to retrieve the egg, but still we will not be able to get any egg, even though on scan we can see good number of follicles.
Thank you, madam. The next question is, how much time will it take for a complete IVF cycle?
When we talk about the timeline for IVF cycle, we are talking about 2 procedures. One is the ovum pickup, that is retrieval of the egg from the woman and mixing it with the husband's sperm and creating embryos. That is called ovum pickup and ICSI procedure. When we do that, usually the injections will go for around 12 days, roughly around 12 days, 2 days this way or that way. Around 2 weeks is the timeline we are looking at. We cannot randomly start. We'll start on day 2 or day 3 of the wife's period. When she gets her periods, we start on 2nd or 3rd day of her periods, and then we take it up from there. Sometimes we do a fresh transfer also, where in the same cycle we can put the embryos back. Sometimes we will not be able to do the fresh transfer because the woman has a lot of eggs and the endometrium, the lining which has to receive the baby, is not ready yet. So these are the common causes why we don't do a fresh transfer. In that case, we will freeze what all embryos we have, and freezing is a very safe technique. And then in the next cycle or next month, then we are going to reimplant, put these embryos back into her uterus when the uterus is actually receptive, ready to receive the baby. So if we are freezing, we are looking at a timeline of 2 to 3 months. If we are not freezing, we are just looking at 1 month.
Thank you, madam. I'm glad to have you back, Dr. Chinmayie, madam.
Thank you, sir. Some technical issues.
Yeah. Next question is to Dr. Chinmayie, madam. Will the injections given during IVF have any long-term effects?
Definitely no. As I've already told, they are all very safe medicines, and these are nothing but the hormones which is already there in the body, but just they are given at a slightly higher dose for a shorter period of time. So very unlikely to cause any kind of long-term side effects. So it is a very safe drug to take. For that matter, any medicine that is given in the IV or an infertility patient, most of them are safer medications, can be taken without any major side effects.
Okay, madam. Next question will be to you only. Will genetic defects affect the success of IVF?
So we see many patients where they've had previous abnormal babies being born. Like I had seen a couple where they've had married within the relation. So after marriage, they've had the first child where the child was abnormal and they had to terminate the pregnancy by 5th month. Then again, she conceived after 2 years, and second time also same thing happened. So then, how IVF helped in our cases when we took the entire family history, then and we did a basic test called karyotyping, and we could see that both of them had some abnormality which they were carrying, and more so especially when they are married within relationships. So what we did for that couple was we did IVF, created the embryos. We knew which was the abnormality both the couple parents were carrying. So for she had about 5 or 6 final embryos, which were day 5. So only when the embryo reaches day 5 stage, we can do a genetic testing on that embryo and identify, for which we call it as PGTA or PGTM or PGTSR. So 3 types of genetic tests that can be done. So once we did those tests, out of them, 3 were genetically normal, another 2 were abnormal. So we identified the one which was normal and then we transferred in the next cycle. So after that, she carried a very healthy baby and she delivered also and living happily with that. So those who are already having any genetic abnormality, and also in a couple who have had previous miscarriages, one of the most common cause for miscarriages is again any genetic abnormalities. So we need to evaluate. So when we suspect prior hand that there could be something like this, we can evaluate, identify the cause, and we know what is the abnormality. We can definitely check in the embryos which of the embryos are chromosomally normal and then transfer those embryos. By doing this, we can give them a healthy child and also avoid those diseases from coming to the offspring also.
Thank you, madam. Next question is to Dr. Jahnavi. Will I lose eggs faster if I take fertility drugs that result in multiple eggs ovulating and releasing each month?
Sir, again, this is one of the very common misconceptions people will have. A woman is born with a fixed number of eggs, and every month only one will ovulate and the rest of them are going to die. Around 8 to 10 eggs will start competing every month on an average, and only one of them will grow. Rest of them are destined to die anyways. They are not going to be there for the next cycle. Okay, that is how a woman's body works. And in our entire life, we are destined to ovulate around 400 months, roughly. That is how it works. So when we are talking about IVF, we are targeting those eggs which are destined to die in that particular cycle. Usually 8 to 10 eggs will compete, and out of which only one egg is going to grow in a natural phenomenon. Now we are going to target those eggs which are going to die, those 8 to 10 eggs which are going to die. We give daily injections so that those will not die. Those will also develop and we'll be able to take out from them. So it is not going to impact in any way the woman's ovarian reserve. That is the number of eggs. It's not going to impact it anyway. So it's perfectly safe.
Thank you, madam. Chinmayie madam, there's a Kannada question. Hi ma'am, nange Electronic City Priyanka ma'am hatra IVF agide. Nange already 6th month running iga. Nange ellathara normal pregnancy na IVF ಆಗಿರೋದ್ರಿಂದ ಡೆಲಿವರಿ ಆಗೋವರೆಗೂ ರಿಸ್ಕ್ ಆಗಿರುತ್ತಾ? ಇದು ಪ್ರಿಯಾ ಕೇಳ್ತಿದ್ದಾರೆ.
ಖಂಡಿತ ಇಲ್ಲ. IVF ಅಲ್ಲಿ once 3 months ಕ್ರಾಸ್ ಆದ್ಮೇಲೆ ವಿ ಡೋಂಟ್ ಯಾವುದೇ ರೀತಿ ಸಪೋರ್ಟ್ಸ್ ಆಗಲಿ ಏನು ಕೊಡೋದಿಲ್ಲ. ಹೌ ಆ ನ್ಯಾಚುರಲ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಯಾವ ರೀತಿ ಕಂಟಿನ್ಯೂ ಆಗುತ್ತೆ ಅದೇ ರೀತಿನೇ IVF ಪ್ರೆಗ್ನೆನ್ಸೀಸ್ ಕೂಡ ಕಂಟಿನ್ಯೂ ಆಗುತ್ತೆ. ಯು ಕ್ಯಾನ್ IVF ಗೆ ಸಿಸೇರಿಯನ್ನೇ ಮಾಡಬೇಕು, ಬೇರೆ ಆಪ್ಷನ್ಸ್ ಇಲ್ಲ ಅಂತಾನೂ ಇಲ್ಲ. ನಿಮ್ಗೆ ಹೆಲ್ದಿ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗಿದ್ದು ಬೇರೆ ಯಾವುದೇ ರೀತಿ ಪ್ರೆಗ್ನೆನ್ಸಿ ರಿಲೇಟೆಡ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಇಲ್ಲ ಅಂದ್ರೆ ಖಂಡಿತವಾಗ್ಲೂ ನೀವು ನಾರ್ಮಲ್ ಡೆಲಿವರಿ ಕೂಡ ಪಡ್ಕೋಬಹುದು. ಅನ್ಲೆಸ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್, ಈಗ BP ತುಂಬಾನೇ ಜಾಸ್ತಿ ಆಗಿದ್ರೆ ಅಥವಾ ಮಗು ಸ್ವಲ್ಪ ದೊಡ್ಡದಿದ್ದು ಬರೋದಿಕ್ ಜಾಗ ಕಮ್ಮಿ ಇದ್ರೆ, ಸೊ ಈ ರೀತಿ ಇವನ್ ನ್ಯಾಚುರಲ್ ಪ್ರೆಗ್ನೆನ್ಸಿಲೂ ಆಗಬಹುದು. ಸೊ ಆ ತರ ತೊಂದರೆಗೋಸ್ಕರ ಬೇರೆ ಸಿಸೇರಿಯನ್ ಆ ತರ ಆಗಬಹುದು ಹೊರತು IVF ಇಂದ ಅಂತ ನಿಮ್ಗೆ ತುಂಬಾ ಜಾಸ್ತಿ ವಿಸಿಟ್ಸ್ ಹೋಗ್ಬೇಕಾಗುತ್ತೆ, ಸಿಸೇರಿಯನ್ನೇ ಮಾಡ್ಬೇಕು, ಬೇಗ ಡೆಲಿವರಿ ಮಾಡ್ಬೇಕು, ಆ ರೀತಿಯಾದ ಯಾವುದೇ ಅವಶ್ಯಕತೆ ಬರೋದಿಲ್ಲ. ನಾರ್ಮಲ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಯಾವ ರೀತಿ ಇರುತ್ತೆ ಅದೇ ರೀತಿ ನಿಮ್ದು ಕಂಟಿನ್ಯೂ ಆಗುತ್ತೆ.
ಇನ್ನೊಂದು ಶಾರ್ಟ್ ಕ್ವಶನ್ ಇದೆ ಮೇಡಮ್. ಹಾಯ್ ಮೇಡಮ್, IVF ಸಕ್ಸಸ್ ಆಗಿದೆ. 4BB ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ 12 ಡೇಸ್ಗೆ 143.72 HCG ಲೆವೆಲ್ ಇದೆ. ಇದು ಓಕೆನಾ?
See, anything more than 100 after 12 days of transfer is considered positive. So positive ಅಂದ್ರೆ ಅದು ನೋಡೋದಕ್ಕೆ ಈಗ ಪಾಸಿಟಿವ್ ಬಂದ ಮೇಲೆ ಆ ಭ್ರೂಣ ಒಳಗಡೆ ಚೆನ್ನಾಗಿ ಬೆಳೀತಾ ಇದೆಯಾ ಇಲ್ವಾ ಅಂತ ಕನ್ಫರ್ಮ್ ಮಾಡೋದಕ್ಕೆ ಡಬ್ಲಿಂಗ್ ಅಂತ ನೋಡ್ತೀವಿ. ಅಂದ್ರೆ 48 ಅವರ್ಸ್ ಆದ್ಮೇಲೆ ಮತ್ತೆ ರಿಪೀಟ್ ಮಾಡಿದಾಗ ಬೀಟಾ HCG ವ್ಯಾಲ್ಯೂ ಡಬಲ್ ಆಗಿರ್ಬೇಕು. ಇರೋದಕ್ಕಿಂತ ಅಟ್ಲೀಸ್ಟ್ ಡಬಲ್ ಅಂದ್ರೆ 2 4 ಆಗ್ಬೇಕಂತಲ್ಲ. ಈಗ ನಿಮ್ಗೆ 140 ಇದೆ, ಸೊ ಮಿನಿಮಮ್ 60% ರೈಸ್ ಆದ್ರೂ ಸಾಕಾಗುತ್ತೆ. ಅಟ್ಲೀಸ್ಟ್ 280 ಬಂದ್ರೂ ದಟ್ ಇಸ್ ಕನ್ಸಿಡರ್ಡ್ ಪಾಸಿಟಿವ್. ಸೊ ಅಂದ್ರೆ ಒಳಗೆ ಹೆಲ್ದಿ ಮಗು ಬೆಳೀತಾ ಇದೆ ಅಂತ ಅರ್ಥ. ಸೊ ಆ ಡಬ್ಲಿಂಗ್ ನೋಡ್ತಾ ಹೋಗ್ಬೇಕು. ಯಾವಾಗ ಬೀಟಾ HCG ವ್ಯಾಲ್ಯೂ 1500 ಗಿಂತ ಜಾಸ್ತಿ ಬರುತ್ತೆ ಅವಾಗ ಸ್ಕ್ಯಾನ್ ನಲ್ಲಿ ನಾವು ಪ್ರೆಗ್ನೆನ್ಸಿ ಯಾವ ರೀತಿ ಇದೆ, ಒಂದಿದೆಯಾ, ಹೇಗಿದೆ, ಎಲ್ಲಿದೆ ಜಾಗದಲ್ಲಿ ಅಂತ ನೋಡಬಹುದು. ಸೊ ದಿಸ್ ಇಸ್ ಡೆಫಿನೆಟ್ಲಿ 143 ಇಸ್ ಪಾಸಿಟಿವ್. ಬಟ್ ಹೇಗೆ ಬೆಳೆಯುತ್ತೆ ಒಳಗೆ ಅಂತ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಡಬ್ಲಿಂಗ್ ವ್ಯಾಲ್ಯೂ ಅಂದ್ರೆ 48 ಅವರ್ಸ್ ಆದ್ಮೇಲೆ ಮತ್ತೆ ರಿಪೀಟ್ ಮಾಡಿ ನೋಡಿದ್ರೆ ಕನ್ಫರ್ಮ್ ಆಗುತ್ತೆ.
Thank you, madam. Like tumba questions about one particular topic they have been asking. So I concise the question and ask you. This question is for Dr. Chinmayie itself. What to do for recurring IVF failures?
Yes, sir. See, many patients, they would have tried multiple places. They would have had at least 2 to 3 transfers in the past, not conceived. So there are various reasons why a woman might not conceive through IVF. So one could be because of if there is any egg the quality issues, or if there is any severe sperm quality issues. Sometimes in semen we see high DFI, DNA fragmentation index. If that value is more than 30%, and then we have selected the sperm in the natural way, like just with the ejaculate sample or usual method how we select. So such embryos will not grow well, means they can either lead to abortion or might not implant only. They might have negative results. So in such people, what we follow is taking the sperms directly from the testes, or there is a newer technique called MAX to select sperms which are normal without high DFI. So like that might be necessary. Or if they have any genetic abnormalities, then also it can happen. Or sometimes we see that the endometrium, the inner lining of the uterus might not be good. They'll be having thin endometrium, or the blood supply to the uterus. So the inner lining, it is not only the embryo that is important to give the result, even the inner lining of the uterus or the endometrium is equally important. So it forms the bed or the nutrition to that embryo. So if that is very thin, does not have sufficient blood supply, then also she might not conceive with IVF properly. So we need to identify what is the possible reasons. Many times we see where one patient came saying she's had undergone 3 transfers before, embryo transfer, and they are all day 5 transfers. So we know that day 5 embryo or a blastocyst embryo has a higher pregnancy rates of 10 to 15% compared to a day 3 embryo. So she had a beautiful 2 embryos were transferred all 3 times, but still she did not conceive. So when we evaluated, we did a test called ERA for her, which is called as endometrial receptivity assay. So that means we will grow the endometrium, the uterus inner lining. Then once we start the progesterones also when it is ready, then when the woman is planned for embryo transfer, like at that time, we just take the bio, we don't do the transfer. At that time, just an inner lining biopsy will be taken and sent for genetic testing. So in that, they will tell whether the uterus is ready to accept the embryo at that time or not. So about 15% of the people, that window gets shifted. The endometrium, the inner lining of the uterus might mature early, might mature late. So they will tell us exactly what time we have to put the embryo. So if that is abnormal and it is a very much correctable cause. So if we just correct the timing and then transfer embryos, 80% of them conceive. So that is so we need to evaluate what could be the cause. Sometimes they can be autoimmune disorders, like they will have thyroiditis. Very common we see high anti-TPO levels where the thyroid values will be 5, 6 at the time of embryo transfer. They will not conceive with that. So a small dose of steroid, bringing the thyroid strictly to less than 2.5 and then transferring will definitely yield results. So before if you have had previous failed IVFs, always evaluate, see what could be the possible cause, and then go for further transfers or further IVF procedures.
Thank you, madam. Dr. Jahnavi,
Yes.
does the process change if using donor eggs or sperm?
Sir, when we use a donor egg or a sperm, when we are talking about donor egg, whatever injections we normally give to the wife, the female partner, we are giving the same injections to a donor. Usually the reason for selecting a donor is because the actual wife has no eggs or very few eggs and the quality of eggs is very poor, or she has some genetic abnormality which definitely they do not want to pass to the offspring. and they do not want to conduct the test on embryos. In such cases, we use a donor egg. The same injections which we are going to give to the wife, we are going to give to a donor, and usually the donors are healthy women, younger women who already have children. So they are of proven fertility. So such women we are going to take, and the process is pretty much the same. We are going to take out the egg from the donor, mix it with the husband's sperm, and then create the embryos. These embryos we are going to put it back into the couple who require children. Okay, these embryos we are going to put it back into the wife. That is how that will definitely have more success rates than with her own egg, because of the reasons which I told about. Either the egg quality must be poor, or she has less number of eggs, or genetic abnormalities. When we are talking about donor sperms, if the patient is azoospermic and if the female partner has no other abnormalities, we need not go till IVF. When we are talking about donor sperm, we can still go and do an IUI. It is not always necessary that an IVF has to be done. We can do an IUI. We can clean the donor sperms and we can process them, and we can inject into the uterus. When the egg, inject into the uterus of the recipient, when the egg is being released, that gives a fairly good chance of pregnancy. When we are talking about a couple who have azoospermia, that is no sperms, and also problems in the female side, that is tubes are blocked, endometriosis is there, that is when we will have to use a donor sperm in an IVF ICSI procedure. The process is again same. We are going to collect the eggs from the woman, inject them with a donor sperm instead of husband's sperm, then put the embryos back into her uterus.
Thank you, madam. Chinmayie madam, ಒಂದು ಕನ್ನಡದಲ್ಲಿ ಕ್ವಶನ್ ಇದೆ. ಮಂಜುಶ್ರೀ ಅನ್ನೋರು ಕೇಳ್ತಿದ್ದಾರೆ, PCOS ಇದ್ರೆ ಎಗ್ ಕ್ವಾಲಿಟಿ ಇರಲ್ವಾ? IVF ಮಾಡಿದ್ರು ಸಕ್ಸಸ್ ಆಗಲ್ವಾ ಮೇಡಮ್? ಪ್ಲೀಸ್ ಹೇಳಿ. ನಂಗೆ IVF ಒನ್ ಟೈಮ್ ನೆಗೆಟಿವ್ ರಿಸಲ್ಟ್ ಬಂತು. ಡಾಕ್ಟರ್ ಹೇಳಿದ್ದು ಸಕ್ಸಸ್ ಆಗಲ್ಲ, ಕ್ವಾಲಿಟಿ ಇಲ್ಲ, ಎಗ್ಸ್ ಅಲ್ಲಿ ಕ್ವಾಲಿಟಿ ಇಲ್ಲ, ನೀವು ಸರೋಗಸಿಗೆ ಹೋಗಿ ಅಂತ ಹೇಳಿದ್ರು. ವಾಟ್ ನೆಕ್ಸ್ಟ್?
ನಿಮ್ಗೆ ಎರಡು ಹೇಳಕ್ ಇಷ್ಟಪಡ್ತೀನಿ ಇಲ್ಲಿ. ಒಂದು, PCOS ಇದ್ರೆ ಈವನ್ IVF ಮಾಡಿದ್ರು ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗಲ್ಲ ಅನ್ನೋದು ತಪ್ಪು. ಸೊ ಎಸ್, PCOD ತುಂಬಾ ಸಿವಿಯರ್ ಇರೋರಲ್ಲಿ ಎಗ್ ಕ್ವಾಲಿಟಿ ಕಮ್ಮಿ ಆಗೋ ಸಾಧ್ಯತೆ ಇರುತ್ತೆ. ಬಟ್ ಅದನ್ನ ನೀವು ಕರೆಕ್ಟ್ ಮಾಡ್ಕೋಬಹುದು. ನಾವು ಕೆಲವು ಆಂಟಿ ಆಕ್ಸಿಡೆಂಟ್ಸ್ ಅಂತ ಮೆಡಿಸಿನ್ಸ್ ಕೊಡ್ತೀವಿ. ಸೊ ಅದನ್ನ ಈಗ ಮಯೋಎನಸಿಟೋಲ್ಸ್ ಆಗಿರ್ಬೋದು, FAQs, ಈ ತರ ಮಲ್ಟಿಪಲ್ ಮೆಡಿಸಿನ್ಸ್ ಅವೈಲೇಬಲ್ ಇರುತ್ತೆ. ಅದನ್ನ IVF ಮಾಡಕ್ಕೂ 3 months ಮುಂಚೆ ಒಂದಿನೂ ಬಿಡದಂಗ್ ತಗೊಂಡಾಗ, ಮತ್ತೆ ತೂಕ ಸ್ವಲ್ಪ ಕಮ್ಮಿ ಮಾಡ್ಕೋಬೇಕು. ಮತ್ತೆ ದೇಹದಲ್ಲಿ PCOD ಇರೋರಲ್ಲಿ ಮೇಲ್ ಹಾರ್ಮೋನ್ಸ್ ಲೆವೆಲ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ಅದನ್ನ ನಾವು ಟೆಸ್ಟ್ ಮೂಲಕ ಅಸೆಸ್ ಮಾಡಬಹುದು. ಮೇಲ್ ಹಾರ್ಮೋನ್ಸ್ ಲೆವೆಲ್ ಜಾಸ್ತಿ ಇತ್ತು ಅಂದ್ರೆ ಮೆಡಿಸಿನ್ಸ್ ಕೊಟ್ಟು ಅದನ್ನ ಕಮ್ಮಿ ಮಾಡಿ ನಂತರ IVF ಮಾಡಬೇಕಂದ್ರೆ ಮೇಲ್ ಹಾರ್ಮೋನ್ಸ್ ಲೆವೆಲ್ ತುಂಬಾ ಒಂದ್ ಲೆವೆಲ್ಗಿಂತ ಜಾಸ್ತಿ ಹೋದಾಗ ಮೊಟ್ಟೆ ಕ್ವಾಲಿಟಿ ಹಾಳಾಗೋ ಸಾಧ್ಯತೆ ಇರುತ್ತೆ. ಸೊ ಅದನ್ನ ಕಮ್ಮಿ ಮಾಡಿ ಮೆಡಿಸಿನ್ಸ್ ಇಂದ ಆಮೇಲೆ IVF ಮಾಡಿದ್ರೆ ಕ್ವಾಲಿಟಿ ಇಂಪ್ರೂವ್ ಆಗಬಹುದು. ಅಥವಾ ತುಂಬಾನೇ ಇತ್ತು, ಅದು ಸರಿಯಾಗಿ ಬೆಳೀತಾ ಇಲ್ಲ, ಕ್ವಾಲಿಟಿ ಬರ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ ಕೆಲವು ಓವೇರಿಯನ್ ಡ್ರಿಲ್ಲಿಂಗ್ ಕೂಡ ಹೆಲ್ಪ್ ಆಗ್ಬಹುದು. ತೂಕ ಕಮ್ಮಿ ಮಾಡ್ಕೋಬೇಕು. ಬಿಕಾಸ್ PCOD ಇರೋ ವೆಯ್ಟ್ ಕಮ್ಮಿ ಆದ ಕೂಡಲೇ ಆಟೋಮೆಟಿಕ್ ಆಗಿ ಮೆನಿ ಫ್ಯಾಕ್ಟರ್ಸ್ ಗೆಟ್ಸ್ ರಿವರ್ಸ್ಡ್. ಸೊ ಅಟ್ ಲೀಸ್ಟ್ 5 to 10% ಆಫ್ ಯರ್ ಕರೆಂಟ್ ಬಾಡಿ ವೆಯ್ಟ್ ಕಮ್ಮಿ ಮಾಡಿ ಮತ್ತೆ ಇನ್ನೊಂದ್ಸತಿ ನೀವು IVF ಟ್ರೈ ಮಾಡಿದಾಗ ಎಗ್ ಕ್ವಾಲಿಟಿ ಚೆನ್ನಾಗಿ ಬರೋ ಸಾಧ್ಯತೆ ಇರುತ್ತೆ. ಮತ್ತೆ ಇನ್ನೊಂದು, ಅಂತವರಲ್ಲಿ ನಾವು ಮೈಲ್ಡ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಅಂತಾನು ಟ್ರೈ ಮಾಡ್ಬೋದು. ಈಗ ನಾರ್ಮಲ್ ಕನ್ವೆನ್ಷನಲ್ IVF ಅಂತ ಮಾಡ್ತೀವಿ, ಅಂದ್ರೆ ಕೇವಲ ಇಂಜೆಕ್ಷನ್ ಮಾತ್ರ ಕೊಡೋದು 10-12 ದಿನಕ್ಕೆ, ನಂತರ ಅದನ್ನ ಎಗ್ನ ರಿಮೂವ್ ಮಾಡಿ ಪ್ರೊಸೀಜರ್ ಮಾಡೋದು. ಈ ಮೈಲ್ಡ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಅಲ್ಲಿ ಟ್ಯಾಬ್ಲೆಟ್ ಇಂಜೆಕ್ಷನ್ ಕಾಂಬಿನೇಷನ್ ಅಲ್ಲಿ ಮಾಡ್ತೀವಿ. ಅವಾಗ ನಿಮ್ಗೆ ಇಂಜೆಕ್ಷನ್ ಅವಶ್ಯಕತೆ ಜಾಸ್ತಿ ಬರೋದಿಲ್ಲ. ಬಟ್ ನಿಮ್ಗೆ ನಾರ್ಮಲ್ ಯೂಶುವಲ್ IVF ಸೈಕಲ್ ಸಿಕ್ಕೋ ತರ 20x 30x ಸಿಕ್ಕದೇ ಇರ್ಬೋದು, ಕಮ್ಮಿ ಬರ್ಬೋದು. ಒಂದು 7x 8x ಕಮ್ಮಿ ಎಕ್ಸ್ ಬಂದ್ರು ಕ್ವಾಲಿಟಿ ಚೆನ್ನಾಗಿ ಬರೋ ಸಾಧ್ಯತೆ ಇರುತ್ತೆ. ಸೊ ಈ ರೀತಿಯಾದ ಕೆಲವು ಚೇಂಜಸ್ ನ ಮಾಡ್ಕೊಂಡು ನೀವು ಇನ್ನೊಂದ್ಸತಿ ಖಂಡಿತವಾಗ್ಲೂ ಪ್ರಯತ್ನ ಮಾಡಿ ನೋಡ್ಬಹುದು. ನಂತರ ನೀವು ಡಿಸೈಡ್ ಮಾಡಂದ್ರೆ ಆಮೇಲೂ ಬಂದಿಲ್ಲ ಅಂದ್ರೆ ದೆನ್ ವಿ ಕ್ಯಾನ್ ಸಿ ಆಫ್ ಅದರ್ ಆಪ್ಷನ್ಸ್. ಬಟ್ ಫಸ್ಟ್ ಇದನ್ನೆಲ್ಲಾನು ಕರೆಕ್ಟ್ ಮಾಡಿ ಖಂಡಿತವಾಗ್ಲೂ ಇನ್ನೊಂದ್ಸತಿ ಟ್ರೈ ಮಾಡಿ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಇನ್ನೊಂದು ಕ್ವಶನ್ ನಿಮ್ಗೆನೆ ಇದೆ. ಮೇಘ ಕರ್ಣೆ ಅನ್ನೋರು ಬರೀತಾರೆ, ಮೇಡಮ್ IVF ಗೆ ಕಾಸ್ಟ್ ಎಷ್ಟಾಗುತ್ತೆ ಅಂಡ್ ಸಕ್ಸಸ್ ರೇಟ್ ಎಷ್ಟು? ಅವ್ರ ಏಜು 27. ಇದನ್ನಾಗಲೇ ತೆಲುಗುನಲ್ಲಿ ಜಾನ್ವಿ ಮೇಡಮ್ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ದಾರೆ, ಬಟ್ ಕನ್ನಡದಲ್ಲಿ ನೀವು
ಸೊ 27 years ಆಗಿರೋದ್ರಿಂದ ಅವ್ರದ್ದು ಸಕ್ಸಸ್ ರೇಟ್ ಚೆನ್ನಾಗಿರುತ್ತೆ. ದ ಮ್ಯಾಕ್ಸಿಮಮ್ IVF ಸಕ್ಸಸ್ ರೇಟ್ ನೋಡೋದಾದ್ರೆ ಇಟ್ ಇಸ್ ಅರೌಂಡ್ 55 to 60%. ಸೊ 27 yearsಗೆ ವುಡ್ ಡೆಫಿನೆಟ್ಲಿ ಸೇ 60, ಪ್ರೊವೈಡೆಡ್ ನಿಮ್ದು ಬೇರೆ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಕನ್ಸಿಡರ್ ಮಾಡ್ಬೇಕಾಗತ್ತೆ. ನಿಮ್ದು ಎಗ್ ರಿಸರ್ವ್ ಯಾವ ರೀತಿ ಇದೆ, ನಿಮಗೆ ಬೇರೆ ಏನಾದ್ರೂ ತೊಂದರೆ ಇದೆಯಾ, ಲೈಕ್ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಇದೆಯಾ, ಅಥವಾ ನಿಮಗೆ ಬೇರೆ ಜೆನೆಟಿಕ್ ಅಬ್ನಾರ್ಮಾಲಿಟಿ ಇರ್ಬೋದು, ಅಥವಾ ಹಸ್ಬೆಂಡ್ ಅಲ್ಲಿ ಏನ್ ತೊಂದರೆ ಇದೆ, ಅವ್ರದ್ದು ಕೌಂಟ್ ತುಂಬಾ ಕಮ್ಮಿ ಇದು ಮಾಡಿಸ್ಕೊಳ್ತಿದ್ದೀರಾ, ಅಥವಾ ಚಲನಶಕ್ತಿ ಇಲ್ದಂಗ್ ಮಾಡಿಸ್ತಿದ್ದೀರಾ ಅಂತ. ಸೊ ಇವೆಲ್ಲಾ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ನ ಸೇರಿ ನಾವು ಹೇಳ್ಬೋದು ಪ್ರೆಗ್ನೆನ್ಸಿ ರೇಟ್. ಬಟ್ ಇಫ್ ಯು ಸೇ ನಿಮ್ದು ಏಜ್ ತಗೊಂಡು ಏನು ಅಂತ ಮೇಜರ್ ಇಲ್ಲ ಅಂತ ಕನ್ಸಿಡರ್ ಮಾಡೋದಾದ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ಐ ಕ್ಯಾನ್ ಸಿ 60% ಸಕ್ಸಸ್ ರೇಟ್. ನೆಕ್ಸ್ಟ್ ಹೇಳೋದಾದ್ರೆ ಕಾಸ್ಟ್ ಬಗ್ಗೆ ಇಟ್ ವೇರೀಸ್. ಸೊ ಆನ್ ಅನ್ ಆವರೇಜ್ ಅಬೌಟ್ 1.2 1.3 ತನಕ ಬರುತ್ತೆ ಲ್ಯಾಕ್ಸ್. ಅದ್ರ ಜೊತೆಗೆ ಇಂಜೆಕ್ಷನ್ ಅವಶ್ಯಕತೆ ಬರುತ್ತೆ. ಸೊ ನಿಮ್ಮ ಒಂದು ಏಜು, ನಿಮ್ಗೆ ಎಷ್ಟು ಓವರಿಲಿ ಎಗ್ ರಿಸರ್ವ್ ಇದೆ, ಸೊ ಇದನ್ನೆಲ್ಲ ನೋಡ್ಕೊಂಡು ಅದು ಕಾಸ್ಟ್ ಡಿಸೈಡ್ ಆಗುತ್ತೆ. ಸೊ ಎಕ್ಸಾಕ್ಟ್ ಆಗಿ ಇಷ್ಟೇ ಆಗುತ್ತೆ ಅಂತ ಹೇಳಕ್ ಬರೋದಿಲ್ಲ, ಅನ್ಲೆಸ್ ನಿಮ್ಮನ್ನ ನೋಡಿ ಏನ್ ತೊಂದರೆ ಇದೆ ಅಂತ ಅಸೆಸ್ ಮಾಡದೆ ಹೊರತು. ಬಟ್ ಆನ್ ಅನ್ ಆವರೇಜ್ ಅರೌಂಡ್ ಈ ರೇಂಜ್ ಅಲ್ಲೇ ಬರಬಹುದು ನಿಮ್ ಕಾಸ್ಟ್.
Thank you, madam. As we are running out of time, I would like Dr. Jahnavi madam to conclude on today's topic. How do you conclude today's topic, madam?
Sir, thank you all for the audience. I think we have covered most of the questions which our viewers have asked. And I would definitely conclude by saying, please, when you're trying for 1 year and still not conceiving, please seek medical care. That is one thing. Second thing, if you have any doubts, please come and ask the experts, because we are here to help you. Don't Google and don't go for unreliable websites which scare us and which make us think that IVF is a major procedure. And IVF has been with us since 1980s. We have progressed well beyond IVF. There are a lot of things we can do after IVF also, like Dr. Chinmayie has said. There are many procedures we can do we can also help for patients who have tried for IVF and have not succeeded. There are many more procedures which we can do and bring out success rates in them. Don't hesitate, please seek out help.
Thank you, madam. Thank you, Dr. Chinmayie.
Thank you, sir.
We are concluding for the day.